Hello, everybody.
Good morning.
Good morning.
Good morning. Welcome to the Mobile Integrated Health Advisory Committee. And we will go ahead and get started with our December 12th, 2025 scheduled meeting. Appreciate everyone being on, and we canceled the in-person out of abundance of caution due to some of the weather around the state, but appreciate everyone being on here. We'll go ahead and get started with the roll call.
Okay, sorry, I was trying to let everybody in as well. Director Craig Kinney,
Present.
Dr. Eric Yazel,
Present.
Dr. Jan Cornlow,
Present.
Samantha Mitchell,
Present.
Joe Harding,
Present.
Chad Owen,
Present.
Amber Marr,
Present.
Shane Hardwick,
Here.
Dr. Ty Sullivan, okay, Dr. Guy Crowder, Andy Van Zee,
Here.
Nate Metz, and Jared Seitz.
Here.
Okay, we have quorum.
Thank you. First up, Emily had distributed. We have the minutes from our last meeting, October 10th, 2025. Are there any corrections to the minutes? Entertain a motion to approve the minutes.
So moved.
Second.
Andy Van Zee with the motion and Dr. Yazel with the second. Go ahead and do roll call on those, please.
Okay, Director Kinney,
Yes.
Dr. Yazel,
Yes.
Dr. Cornlow,
Yes, sorry, we're looking for the button.
no, you're okay. Samantha Mitchell,
Approved.
Joe Harding,
Approved.
Chad Owen,
Approved.
Amber Marr,
Approved.
Shane Hardwick, oh, I think we lost Shane. Moving on, Andy Van Zee
Approved.
and Jared Seitz.
Approved.
Okay, minutes are approved.
Okay. So we have a quorum, and minutes are approved. So now for our reports. For a state director's report, I don't have a lot. I think Dr. Yazel will probably elaborate. Rural Health Transformation Program, assuming we get money after yesterday's vote on the redistricting, which was kind of impactful on the federal level. We will see what money Indiana receives on rural health, but there are a number of MIH initiatives in there. And so we hope to be talking about those as we go into the 2026 meetings. Kind of the plan for here, and so everyone understands where we are on potential rulemaking. We have the authorization by statute, but you also may have heard the administration would like to reduce rules and try to streamline them. We are submitting a proposal, and we're starting with some modifications to the EMS rules and updating. And that will likely be, and it has to be over a 4-year plan. So I believe next year will be devoted to the EMS rule rewrite. And then year 2, we are going to propose adding MIH rules, which would give us all of next year to keep compiling those and also start through the process of our development, but then our approval here as a group and then on to the commission. So that way the EMS commission can consider them as well. So those are kind of the big ticket items that I have. We'll turn it over to Dr. Yeasel for his report.
Yeah, not a whole lot in addition, just to double down on that Rural Health Transformation Act, like Craig alluded to, or Director Kinney alluded to. There were some threats that if we didn't vote for redistricting, that some of our funding might get cut significantly. So a little bit of that remains to be seen. But yes, especially in terms of the regional collaborative grant portion of that, I think MIH is really well positioned. So we don't know what those regional groups look like just yet. Initially, it was going to be the IDOH preparedness districts, but it sounds like they've moved a little bit away from that model. I think a long story short is, as that firms up, you know that regardless, it's going to be you and some of the border counties of wherever you're providing care at. And it's going to need to be probably multi-county in nature to be accepted. So I think now is a great time just to take, your pocket of where you're providing care, have some discussions of what do we need from a mobile integrated health standpoint, what would help us and what would help us expand our coverage areas if indicated, and start having those conversations so that when the consortiums kind of get firmed up as far as territory and who the funded body would be and things like that, you're ready to move quickly right into the grant application phase versus spending the first half of everything just trying to get organized, which if you're like some of the counties down by where I am, getting 4 or 5 counties to work together can be a real challenge. So I think starting those conversations now is important. Some of those other initiatives, I do think there'll be some MIH friendly things coming out, but yeah, it's probably worth waiting to see what our final disbursement looks like before we really start talking in concrete terms. So I think that's all I have right now. Oh, there's one other thing at the federal level that we're watching pretty carefully. There's a bill for alternative destination. Right now, as written, it is for run through 911 kind of alternative destination transports. But I do think, if there are amendments, there's some mobile integrated health potential there as well. Probably worth following as it gets revised over time. So I think that's it.
So Dr. Yeasel, are you able to see my screen?
I am. Is this the final one? I knew it was coming.
This is the final draft. This was shared with hospital, the IHA board yesterday, and is going out to all hospitals today. This is what is the current proposed kind of breakdown of the 8 regions. The colored in counties are those counties that are identified as rural, or the ones that are kind of hashed are partially rural. The counties that are in white are per HRSA are not rural or partially rural. They may still be eligible for funds if they indirectly provide services to rural communities. So in case of like an EMS side, there is some possibility that those counties in white still could receive some funding. But this is at least the probably best starting map for some of those kind of regional discussions.
Awesome.
Thank you. And I think, and that is still, as Dr. Yeasel and I've been echoing, and Andy's kind of reinforcing, I think we need to keep looking at and start thinking about regional approaches, and kind of how you can tag team with other MIH around you, but also it wants to look at different types of departments. So if you aren't already working with a health department or a hospital, then that's something that you should definitely be looking at for your MIH programs. For this month's presentation, we have a special presentation from our partners at the Indiana FSSA Division of Disability, Aging, and Rehabilitation Services. And I see we have, and I apologize if I mispronounced the name, Prabi and Sarah on.
Yes, good morning. Thank you for having us. I'm Sarah Hensley with Public Consulting Group. We are contracted by the state to provide adult protective services to the entire state. Prabi, would you like to introduce yourself?
Hey, hi everyone. I'm Prabi Najjar. I'm the APS director with the Bureau of Better Aging with FSSA. And Sarah and I will be doing the presentation today.
Thanks, Prabi. I'm going to go ahead and flip my camera off so you guys don't have to watch me do this. So our agenda, we are going to cover just an overview of the PCG team, our duties, how to connect endangered adults with APS, requests for information, questions, and then we have a slide with contact information. So our project overview and Team PCG. Go ahead. Yeah. Margot Jones is our project director. She makes sure that all of the issues with any of the big issues, she addresses invoicing, she's my supervisor. I'm the operations manager, so I supervise the regional supervisors. A little bit about me, I have a bachelor's degree in social work. I worked as a crisis therapist for several years, as well as a case management for older adults. And I've been at PCG for over 10 years. During my time at PCG, I did investigations for the Ohio home care waiver, which is the Medicaid waiver in Ohio. And I also did, we worked on an APS backlog for the state of Washington. So that's just a little bit about me. We do have 4 supervisors right now. Brenda Ayala is in Region 1. Lynette Ashburn is Region 2. Julie Stewart, Region 3. Sue Ellen Cobble, Region 4. And then we're pending a replacement for Region 5. So we are currently interviewing for that position. This is the regional structure. It is broken down into 5 regions. They are rather large regions. We have a supervisor for each region. There's one designated for each region. And then within each region, there are investigators. They're spread throughout that region and provide in-person visits to anyone within the region. We do utilize occasionally, if we have someone on a border, we might use someone in Region 1 to help out with Region 2. But this is the layout of our regions as we sit today. Project mission and overview. We are proud to partner with the state of Indiana and operate as a unified statewide adult protective services program. Our model includes a centralized intake, regional investigation teams, and enhanced support through training, data tools, and quality oversight. Our goals are to prioritize clients' health and safety while balancing their rights to autonomy. Working with the stakeholders to link endangered adults and their families to resources to support their needs in the least restrictive manner. Provide consistent support to Hoosiers throughout the state and remain flexible as we're navigating this transition. We got the contract in July 1. I'm sure many of you are aware of that. So you may have seen some differences. Just might look different depending on what area you're in. It sounds like, from what my understanding is, things were done differently depending on which part of the which county you guys may have been working with. So Indiana Adult Protective Services duties.
Don't put them on. I'm going to take them back. I'm going to exchange them for a bigger size. I know, but they'll fit longer.
I think
Maybe I'm gonna wear
somebody's
'em next
on.
year too, if I get bigger.
Got your camera
You
or
get it
your
close?
microphone on. Okay, there we go. You mind going to the next slide? Thank you. The duties of Adult Protective Services unit having reason to believe an individual is an endangered adult. The law has not changed. The statute is the same, with the exception of they did remove habitual drunkenness from the rule. So if Adult Protective Services has a reason to believe that an individual is an endangered adult, Adult Protective Services will do the following. We'll investigate the complaint, make a determination whether the person is endangered, and we will make referrals to law enforcement or other agencies as warranted. If we determine that the individual is endangered under this chapter, we'll initiate procedures, our Adult Protective Services, and we'll base an evaluation on the needs of that endangered adult to protect them in their environment. We coordinate and cooperate with the division or other appropriate persons to obtain protective services for the endangered adult, include developing a plan to mitigate reoccurrence of allegations of battery, neglect, and exploitation. We do monitor the protective services for a very short time. We don't do case management, so we don't spend an excess amount of time. We have 60 days to complete our investigation. So many of those are closed prior to the 60 days. That is our goal, to have cases closed within 60 days. There are occasions where it warrants us to keep those open a little bit longer, but our goal is to get them services as soon as possible, even if we can do that at our first interaction with that person or family. So who is an endangered adult? In the state of Indiana, an endangered adult is an individual who is at least 18 years of age, incapable by reason of mental illness, intellectual disability, dementia, or other physical or mental incapacity of managing or directing the management of the individual's property, or providing or directing the provision of self-care. And they're harmed or threatened with harm as a result of neglect, battery, or exploitation of the individual's personal services or property. So APS emphasizes on the self-determination piece. People have the right to make poor decisions. They're allowed to. If they have the capacity to make a decision, whether that's good or bad, we allow them that right. If an endangered adult has decision-making capacity, they can decline our services. We have no legal authority to force them to work with us. In all cases, our goal is to respect the individual's beliefs, values, and preferences as much as possible. So our duties include screening and triage. At that time, that's when the reports that are submitted are reviewed. We determine if they meet criteria for APS involvement. We also assign a triage level. And once the triage level is determined and the case is screened in, it would go to a regional supervisor to be assigned to an investigator. If the report is screened out, then we will email or call the reporter to inform them of the case being screened out and the reason why. I did just this week, someone had mentioned that they didn't get a notification when they submitted their online report, like a confirmation that it was submitted. And there's an option to hit, I think it's called provider, to identify yourself as a provider. If you do that, you will get the automatic response letting you know we received your report. The assignment and investigation, we meet with the alleged endangered adult, assess their capacity, any immediate safety and health concerns, conduct interviews, request records as needed, and connect that person with services as appropriate. If it is a legal matter, if there's criminal allegations, we refer that to make a report to law enforcement so they can investigate. If a facility is involved, we make the appropriate referrals for that as well. The case closure, we determine whether the allegation substantiated or unsubstantiated, and we're using a preponderance of evidence. So we could have 51% indicating that more likely than not, the allegation occurred and the person responsible more than likely did, committed that allegation. We ensure all necessary referrals are made, and prior to closing that report, we do notify the reporter that the case is being closed. In the event another allegation comes to happen, then they know they can submit a new report to have that addressed. This is our APS investigation workflow. I'm not going to spend a lot of time here. It's just kind of show kind of the process that we take and the steps and the order that we take them. A case plan is any steps that need to be taken to evaluate the allegations and assess capacity. So interviews, coordinating with law enforcement, IDOH, requesting medical or financial records. Service plan includes, but not limited to, making those referrals to local programs, assisting with Medicaid eligibility process, identifying any informal plans or support coordination with friends and neighbors. Normally that is our first option. Can we connect them with, is there family, friends that could assist them? Normally that's going to be more of we know community resources are limited, so when we can utilize family, friends, neighbors, it's normally something that the individual prefers anyways, someone they know. If we do, if needed, seek protective orders and link people with guardianship agencies to help with that. We do not do guardianship, but we will link them with programs like VASIA, or there's some private guardianship agencies out there. We've been meeting. I met with Nick Parker yesterday with VASIA. Got a lot of information from him, so I'm pretty excited to share that with our team. Connecting endangered adults to APS. This is what you guys would be doing in the event you encounter someone in the community who has been allegedly abused, neglected, or exploited. That includes self-neglect. Indiana is a mandated reporting state, meaning everybody is required to report any suspected neglect, battery, or exploitation. All reports are secured and kept confidential. Reporters remain anonymous. We do not share that information. One thing we like to remind folks is we are not an emergency responder. If you believe someone is in immediate danger, call 911. And you can file a report online or by calling the state hotline. More than likely, it's probably going to be easier for you as providers to file that online report. There is a map, the map that we showed you of the regions, that's also on there. If you need the regional supervisor's contact information, if you hover over the county, that regional supervisor's information will pop up. I also use personally the 211 directory for resources. And I use that regularly, as well as Google is my best friend. We spend a lot of time together because I'm constantly looking things up, trying to find resources or thinking outside the box on ways we can support endangered adults. Filing report, this is just a screenshot of the online form. And I'm going to go through kind of the important pieces that it's really helpful for us to know so that we can properly screen that report, depending on, to determine if more than likely, there's evidence of them lacking capacity, or just painting that good picture for us so that when we do go out to the home, if it's screened in, we're as prepared as possible from a safety standpoint, as well as being prepared with resources that may benefit that person. So filing a report, contact information. In regards to the endangered adult, an address of their location, street address, where they reside, if they're in a hospital, if you can let us know that. That doesn't mean it will be screened out, but it's really important for us to know if they're not in the home, because we don't want to make an unplanned visit to the home and they're not there. So if we know they're in the hospital, we can connect with the hospital first, find out what's going on from that standpoint, and we can work with them when that person discharges and make that home visit so we can see them in their normal environment. If a person is homeless, that does not mean we will not. They don't qualify for Adult Protective Services, but if you state a person is homeless, we need a location. We don't have the resources to spend time looking for someone. So even if it's, behind the Dollar General or at a street intersection, those things, we can go to those locations. If you have a phone number, if you can provide that. In regards to the alleged perpetrator, phone number, address, and their relationship to the endangered adult, any other involved parties, whether it be family, friends, neighbors, if a doctor's actively involved, or a counselor. If you're aware of those, provide as much information as you can so that we can connect to them. With capacity and diagnoses, you don't have to know for sure if they have capacity based on a diagnosis. But if you suspect someone may lack capacity, explain that to us and why you feel that way. Paint us that picture so that we understand kind of what deficits you may be seeing, even if it's, sometimes someone will have a lack capacity as a result of a UTI. Maybe they're disoriented, can't make decisions for themselves. So, but then they get the treatment they need, go to the hospital, get treated, and they no longer lack capacity. So just painting that picture so that we understand what concerns you're having when you're working with these folks. Diagnosis, if you're aware of a mental health diagnosis, medical diagnosis that may impact their capacity, please share that with us. Own safety concerns is a big one for us. We are going into homes. We are not armed, nothing like that. We are regular people going into homes. So anything you can share related to any safety concerns is very helpful. If you know that there's substance use or abuse in the home, behavioral concerns, if that endangered adult gets agitated easily, if he or she becomes violent, if you've seen evidence of that, share that. Environmental concerns as well, if there's rodents, bed bugs, no water, electric, dogs present, specifically if they're aggressive. Just knowing there's dogs present and they're nice is good to know, so that when we do arrive, we kind of know what to expect. It's always, we want to make sure that not only is the endangered adult safe, but we also want to remain safe while we're in the community. If we're aware that there is criminal activity or significant safety concerns, we will utilize law enforcement to assist us. And or we may just utilize another investigator and make that a two-person visit. So we really do value that information and evaluate that prior to going to our home visits. Completing the narrative. Give us a detailed description that includes the type of abuse, exploitation, or neglect. Let us know who, what, when, and where information. You may not know all those, but give us what you can. The more information you tell us, the better prepared we can be to go see that person. Many of our visits are unannounced so that we can see them on a normal day. And see what the environment is at a normal moment, their condition in a normal moment. If you've attempted to assist that endangered adult in any way, let us know what attempts you've made, whether you've, referred them to services and they've refused. If we know they've been refusing services, we'll be strategic in the way we approach that. Or maybe work with you as the reporter and see what you tried, and we'll try a different approach. Sometimes people just need someone different. So we can try different approaches. And if you're aware of any legal charges, let us know that. If we know that law enforcement is involved, we want to connect with them before we go out, because we do not want to interfere in any, investigation they may be working on. Request for information. So if you do need information, if you want a copy of a report, anything of like that, there's a slide here. Our next slide here will give you direction on how to do that. I guess it wasn't the next slide. I lied. I've got the confidentiality statute. Ultimately, we cannot just give out reports. So if you call and are asking for information, the only way we can provide that is if the purpose of that is to provide monitoring for protective services. Otherwise, if all parties are consent to us getting or sharing the report, and the other way that we can provide a report is a court order. Here's the slide I thought was next. Records request. If you do need records, please just email us. Let us know in detail what you need from us. If there is a court order, provide that. We work with our legal team to ensure that we are compliant with the confidentiality and only sharing reports or information as necessary. If you happen to have the case report number, that's really helpful to include. First and last names of the endangered adult, also very helpful. Questions and answers, or Pravi, do you have anything you want to add before we go to questions and answers?
No, not necessarily. But we just want to make sure that you guys know that we are looking for partnerships across Indiana. So if you guys have any groups or any other organizations that you work with locally that you would like to connect us with, that'd be great. You can email myself or Sarah. Just with this program going through a transition, we are trying to make a lot more local partnerships and really get to know our local communities, especially our supervisors in the different regions. So definitely reach out to us if you guys have any suggestions or anyone you think we should connect with. But yeah, we can open the floor for some question. I did see there was a hoarding question in the chat. What about hoarding? So I would definitely report that, but hoarding is a choice that the person is making. So there would be an investigation that would have to go further than just someone's house in regards to condition outside of the hoarding as well.
Yeah, so if they're,
Yeah.
if it's a hoarding home, the thing, is this someone who is choosing that, or do you feel like it's out of their control? They aren't making that decision for themselves. It's not a choice. They don't have the ability to manage their home, things like that. Definitely report to us. Include that piece about the capacity and what you're seeing so that we can assess if it meets APS criteria, and also just prepare us for that home visit. So contact information, the state hotline number is here. The Bureau of Better Aging, Pravi, the director, her email, me as the operations manager, my email. And if you have general APS case inquiries, if you can email our general email box, we review those and we'll make sure we link you with the appropriate person to answer your questions. I know we get a lot of emails, follow-ups asking what the status is of an endangered adult or our investigation. Give us that person's name and we can look them up in our system and connect you with the investigator, or let you know if that case had potentially been closed. Keep in mind, if you are the reporter, you should be notified that the case has been closed. But if you do happen to have any challenges, or there's something we're doing that's not working well for you guys, please let me know. We want to work well together. So if we're not doing something that's making your life easier and it's making more difficult, please connect with me and let's see if we can work out a solution to make things easy for both of us. We really do want to work with the community and provide the best service we can to the endangered adults. Anyone we encounter, even if someone's not endangered and they need a service, we want to link them with that. Ultimately, our goal is making sure people have what they need to be safe in the environment they want to reside in.
Thank you. Thank you.
You're
Lots of
welcome.
good information. We do have a few requests in there, and one of the questions we had was whether we can share the slides and whether people can put those out. And then a second follow-up question. We have an ACADIS, which is our software platform for certifications, which it has an LMS component. And there was a question whether we could include that on ACADIS so that way they could refer staff that are doing MIH to see these things.
I don't have an issue with that, but I'll let Pravi answer that just from
I think that's totally fine. You guys are more than welcome to share these slides as well as upload them into your system. We shouldn't have a problem with that. As things update, we don't see any updates from this general knowledge. The regions will stay consistent. The information, contact information sometimes changes depending on supervisors and things like that. So we can always update you guys on that. And if you have questions on the most up-to-date phone numbers and emails for our regional supervisors, you can always go on the APS state website. It has an interactive map where you can click on the county and then you can see who the supervisor for that county is and how to get in contact with them as well. So if you want to include that that link into your guys's email or however you share your information, that would be really beneficial for people.
Yeah, Emily does a great job for us that scheduled you guys, and so she would probably be emailing out the slides so we can include that link if she has it then.
Okay, awesome. And I do see, when do you believe a Region 5 supervisor will be hired? So we are in the process of, I believe, Sarah, correct me if I'm wrong, we are interviewing at the moment.
We are.
We are actively interviewing and actively recruiting. So we're hoping to get someone onboarded here in the next couple of weeks. Our onboarding does take a couple of weeks to get trained and go through, the hoops of that. So we're hoping into the new year we'll have someone for Region 5 updated for you guys.
I don't recall if I heard an answer. We had a question as well in the comments that says they might have missed it, but can you upload pictures to a report?
Do you know if you can do that when you submit a case? I'm not sure you can, but you could email it to that general
Yeah,
email
I was gonna
box.
say, I don't think you can attach it in the portal. At the moment, I know we are going through some enhancements with our portal as well. But you can always go ahead and email it on that general email that was added in. And just write down the name of the person that you want these pictures attached to, and then you can go ahead and email those pictures over to us.
Great, thank you. Ryan, go ahead with your question.
Yeah, hi, this is Ryan from Sandberg County Fire Department down here in Brandenburg. We had some feedback from some of our deputies here locally that they were trying to use some of the same methods that they had been previously using. What are the biggest changes you guys are seeing from pre-July 1 to now as far as reporting processes and feedback? And obviously we kind of went through how to get that feedback through your online portal, but is there anything that does not work now that did work prior to July 1?
I don't believe so. I think everything that was working prior to July 1st has transitioned over fairly smoothly. If anything, we are working on more consistency across the board. And we are working on having follow-ups, whereas every unit before we transitioned had their own standard policies, and it was not consistent at all across the state. So someone in the Northeast could be doing something completely separate from someone in central region and southern regions. So what we've worked on very, very hard in this transition has been consistency. So I believe moving into the transition, if anything, we've taken all the good parts of, we had the hotline still active throughout the transition. We were still working on cases as we transitioned over. But I think moving forward, if anything, we have tried to improve this process as much as we can. And really, really working on making sure it's a smooth sailing process for everyone while we are working through this transition.
Got a follow-up on the email question. Someone had indicated, Nate had indicated our pictures would be part of the medical record, thus it might be PHI. So they were questioning on the email. It looks like maybe Sarah had an answer.
Yeah, feel free to send things securely if you have that ability. If not, we do have a fax number that I can share with you if that is preferred.
What's a fax machine? No, I'm
What?
teasing.
Right? Do those work anymore? It's dial up, so have patience. It'll take a minute to get to us.
We have, the reason I say that, we have a few at the state that are published and they go to emails, but it is the weirdest thing because an email just pops up with it. So
That's how ours works. Well, it goes to a central email box and then we distribute them. Yeah. Yep.
does anyone else have any questions? Raise hand feature, please. Well, thank you. Appreciate the presentation, Sarah, and Prabi, thank you for being here. Both of you answering questions, very beneficial. I'm sure we will have follow-up for you guys.
Thank you so much for having us. We appreciate your time.
Yes, thank you. It's been a pleasure.
Kelly, we're going to email all the slides out to everyone, so you should be getting those. So. Okay, the next item we have is new business, and we have several programs for approval this month, and so I will turn over to Emily.
Okay, give me just a second to get all my stuff shared with you guys, and then Okay. Can we see this on the screen? Or do you see there we go. Okay. So we have 4 programs that we're going to review today. So I'm just going to kind of quickly go over the first half of this application or the PowerPoint that I have. So these programs that we're reviewing today, obviously December the 12th, they will be reviewed and then voted on, and then after that they will have to go to the EMS Commission for final approval, and that next meeting is on January the 9th of 2026, not 2025. I caught my own mistake. The application process has not changed, so the link is still the same. If anybody has questions, I will answer those for you afterwards. Application requirements, all of those have stayed the same as well. So the 4 programs that we are going to be reviewing today, we have Harrison County Hospital EMS, we have Links EMS, we have Madison County Township Fire Department, and Manchester Township Volunteer Fire and Rescue. So the first we will be reviewing is Harrison County Hospital EMS. They're located in District 9, covering specifically Harrison County. Their main initiatives they really want to focus on are hospital dismissals, those post-discharge follow-ups, really trying to prevent that readmission, diabetic counseling, decreased utilization of EMS, and elderly management programs. Their broad goals for their program, they really want to work in partnership with local health departments to address those KPIs that were already set by the Health First Indiana funding source. They really want to produce a reduction in 911 calls for lift assist by increasing awareness of mitigating risk and evaluating those mitigating factors associated with falls. Their providers will be required to be a current Indiana EMS provider. They have to hold a certification with the state, as well as a current AHA BLS certification or ACLS. And if they do hold an ALS, if they are an ALS providers, they will be required to have a PAL certification. As well as have to have a current hazmat awareness and operations cert, and have to have a current driver's license, obviously, and then complete the NAEMT community paramedicine education later on. We do have a few representatives from Harrison County Hospital EMS. If you guys would like to further elaborate on your program, you can do so now.
Sorry, trying to get unmuted there. Jeremy McKim's here, the EMS director for Harrison County Hospital EMS, and also Jacob Metcalf, who's going to be our MIH coordinator for the hospital. I'll let Jacob give his little spill, and then I can follow up.
Yeah, so basically, we're going to be hoping to get referrals from the ER and the physicians in the hospital due to being a hospital-based organization and going out to those patients that are, having frequent readmissions in the hospital, and also working with our EMS department at the hospital. Our MIH program will actually be a separate department of the hospital, so it'll be kind of coordination with EMS, but its own separate organization. And currently, we're in the process of solidifying procedures, protocols, SOGs, and getting community resources established.
And I would follow up with that. This program is in partnership not only with the hospital, but also the local health department. The funding for this project did come from HFI funding through the local health department. So we have agreed to help them work on their KPOs for 2026, which were outlined and submitted to the state, which is a reduction in the falls among adults age 65 and older in Harrison County over the time period, and then also a decrease in prevalence of type 2 diabetes among adults aged 18 years and older. So going out and following up those diabetic patients that may or may not be in compliance with their medication regimen and all of that. So we're pretty excited about this program to get it approved and on the way. Many programs that we spoke to over the time said start small and work larger. So that's what we're doing. We're starting with a couple of different items that we're going to focus on and then see where this sprouts into.
Okay, thank you guys. So that is for Harrison County Hospital, and we will move on to our next one. So our next application that we received is Lynx EMS. The map looks a little chaotic, so I will explain that real quick. They are their home base is primarily out of Marion County. The small red dots on the map indicate all of the other stations that they have. So they have coverage in all of those counties. So they would primarily tackle hospital dismissal and post-discharge follow-up, decreased utilization of EMS, substance abuse mitigation, and mental illness mitigation. But those counties that they will cover, Boone, Clark, Floyd, Hamilton, Hancock, Hendricks, Jefferson, Jennings, Johnson, Marion, Morgan, Scott, Shelby, and Washington counties. So their broad goals are mainly to focus on those high utilizers of the 911 system, really decreasing recurrent patient transports and trying to improve that overall patient health outcome. Their providers at this time will be required to be in good standing with their company education standards, but no other additional education and certification is required at this point. They're just trying to kind of figure out where they want to go and kind of like the previous program had stated, start small and then grow from there. And do we have any representatives from Lynx online that would like to further elaborate on their application? Okay. So hearing none, I'm going to go ahead and move forward with our next application. So that will be Madison Township Fire Department. They are located in District 5, covering Morgan County. The initiatives that they had initially put on their application are the hospital dismissal, post-discharge follow-ups, or post-response follow-ups, I'm sorry. Diabetic counseling and monitoring, chronic disease management, that decreased utilization of EMS, OB and newborn management, elderly management, immunizations and vaccinations. And their broad goals for the program are to assist their residents with medical care that prevent them from needing emergency care as often. Providers will use this as a tool for patients and residents to improve their quality of life, their quality of medical care, and education for their overall health. This will limit the needs for emergency medical attention. Their outcomes for this will result in healthier residents and limit 911 calls and more educated patients for their specific needs. Right now, the providers that will be involved with this program will be required to attend a community paramedicine and MIH certification course. Is there anybody online for Madison Township Fire Department that would like to further elaborate?
Hi, good morning. How are you guys?
Great, thank you.
Good. This is Steve Hartsock. I'm the fire chief for Madison Township. Excuse me, I got a little bit of a lisp. I had a dental procedure a couple days ago, so I apologize. But yeah, so similar to the first program that was announced, all of our providers will still be required to have, the state requirements for a paramedic and an EMT, all the AHA, all that good stuff. Basically, the minimum requirements to work here, right? And then if the course, which we're pretty excited, and hopefully it does get passed today, but if it does get approved, then they will attend the community paramedicine and the mobile integrated health certification course, and then the continuing education with that. And then, like somebody stated earlier, how we're going to start small and see where it goes. That's kind of our goal too. We don't want to take on obviously too much right off the bat, but we do want to get it established, get proof of concept, start small and work our way up, and hopefully turn this into something big for our township, and maybe even for our county. I believe the county EMS system, I think, does some, but I'm obviously willing to, if it's approved and we have it established, not just do it for the township, but outreach everywhere into the county and make this kind of a big thing for all the residents if we can. So, but anyways, yeah, that's all I have.
Thank you, Chief. Okay, so we will move on to our final program for application. This is Manchester Township Volunteer Fire and Rescue. They are located in District 9, and that is covering Dearborn County. The initiatives that they had initially chosen are hospital dismissal. This is for post-response follow-up, diabetic counseling and monitoring, chronic disease management, decreased utilization of EMS, substance abuse and mental illness mitigation, OB and newborn management programs, elderly management, and immunization and vaccine initiatives. I will point out that this is a very rural area, so that's kind of the need for all of those things out there. They have kind of a spread out area. So the broad goals of their program are essentially just to improve overall health and wellness within the community. And as stated earlier, their providers will also be required to be in good standing with the department as well as the state, but there's no education, no additional education or certification at this time. Do we have anybody with Manchester Township that's online that would like to go into further detail? Okay, hearing none, that is the end of my program applications.
Thank you. Any questions of Emily on the presentations? We have Harrison County Links EMS, Madison Township Fire, and Manchester Township Volunteer Fire.
Move to approve the list as presented.
Okay, we have a motion. Is there a second?
Second.
I'll second. Andy and I think Dr. Yeasel. Clarify, this would be recommending approval to the EMS Commission. Go ahead. Any further discussion, comments? Okay, let's go ahead with the roll call.
Okay, Director Kinney.
Approve. Recommend approve.
Dr. Yeasel.
Recommend approve.
Dr. Cornlow. Oh, he may have gotten pulled away. Samantha Mitchell.
Approve.
Joe Harding.
Recommend approval.
Chad Owen.
Recommend approval, please.
Amber Marr.
Recommend approval.
Shane Hardwick.
Approved.
Dr. Sullivan.
Approve. Approve.
Dr. Crowder.
Recommend approve.
Andy Van Zee.
Recommend approve.
Nate Metz.
Recommend approve.
And Jared Seitz.
Recommend to approve.
Okay, so these programs have been recommended for approval, so they will be presented at the next EMS Commission meeting.
Thank you. Just as a matter of record, we did the roll call earlier, and I know we have caught up, but just for the record, we did get joined by Dr. Ty Sullivan, FSSA, and then Nate Metz as well. So they will be shown as present. Emily, did you have anything else from a staff perspective? I usually call on you on my comments.
I really didn't have a whole lot. I do have a slide that I'm going to share kind of towards the end that just has all of our meetings for next year as well as the quarterly meetings too. I know we've had quite a bit of new programs over the last year and a half. So I really wanted to share that with everybody and make sure that they were aware. Other than that, I don't have a whole lot for everybody else.
So get your screen captures ready because we are up to that moment so you can proceed with the calendar information. We can email that out too on the dates and stuff.
Yes, I will absolutely be emailing this out as well. I just figured it would be easy to also share this with you guys as well during the meeting.
So there we go. Thank you, Emily, for coordinating. We have the MIH will be at MAID. Yes, subject to weather. We have them there. And then the quarterly meetings are always good discussion points. Appreciate Emily coordinating that. And then the support from Corey as well. Anything further on that, Emily?
Nope, that was all I had for those.
Okay. Anything further from the group?
I just wanted to tell you all seriously, thank you. I put it in the chat, but thank you for recommending our approval to the EMS commission. So thank you guys. I sincerely appreciate it. It's a big, this is a big deal for our fire department. So thank you and our citizens.
Thank you. We're excited for actually all four of you. And I know everyone on here that is approved and in our office certainly knows that it's not a simple process to get ready to actually implement these items. And it's always a first step too. So when you need assistance, the good news is I continue to be impressed by the brotherhood among EMS, brotherhood and sisterhood, I should say, among the MIH providers. People are always willing to share. So congratulations on the recommended approval to those four. Also wrap up is a good segue into my final comments, which were thank you for a productive year. We had a lot. We had several great conferences. And then just the amount of momentum we're seeing with MIH, that the communities are investing in them. When you have a national grant with $50 billion and MIH is listed as one of the line items, then that is a great example of the value of MIH and what you're doing every day in the communities. So appreciate everyone, what you're doing for MIH. We'll continue to work for you, and we look forward to seeing you into the new year. So I will entertain a motion to adjourn. Or I will just. Okay, thank you.
I'll second.
Okay, we will show that we are adjourned. We are not going to do a roll call vote. So thank you, everyone. Happy holidays. Keep up the great work. Let us know what you need.
Thanks, guys.